Look, Bumble knows you're exhausted by dating. All the, must not take yourself too seriously, and 6'1" since that matters. And what do I even say other than, hey? Well, that's why they're introducing an all-new Bumble, with exciting features to make compatibility easier, starting the chat better, and dating safer. They've changed, so you don't have to. Download the new Bumble now.
If you're struggling to lose weight, you've probably heard about weight loss medications like Wegovy or Zepbound, and you might be wondering if they're right for you. Meet PlushCare, a leading telehealth provider with doctors who are there for you day and night to partner with you in your weight loss journey. If you qualify, they can safely prescribe you medication from the comfort of your own home. To get started, visit plushcare.com/weightloss. That's plushcare.com/weightloss. plushcare.com/weightloss.
This is Optimal Relationships Daily, episode 2193, 5 Things to Do When Someone Needs You Too Much, by Dr. Margaret Rutherford of drmargaretrutherford.com. Hello, everybody. Happy Sunday, and thanks for spending some of your weekend here with us on ORD. I'm Greg Audino, your host and narrator. Glad to have you back with me once again, this time for a really terrific and really necessary post from Dr. Margaret Rutherford. So what do you say we jump right into it and start optimizing your life? 5 Things to Do When Someone Needs You Too Much, by Dr. Margaret Rutherford of drmargaretrutherford.com. I don't know how I would make it if I didn't have you to talk to. Sometimes I just want it to be over, but I know I have you, and that keeps me from doing anything. If I lost you, I'd be nothing. Words like these should send a shiver up your spine. If they don't, you may have an intense need to be needed, and that's a problem as well. If it's said in jest or understood to be an exaggerated statement of love, then that's not worrisome. Or maybe its source is someone who's facing a dire circumstance, such as caring for an ill parent or having suddenly lost their job. Perhaps it could reflect deep gratitude or acknowledgement of you being there. But if these words are routinely said in the context of an everyday relationship, alongside conversations such as, "What are we doing Friday night? Did you get my text?" or maybe even, "I think I need therapy," then you're in troublesome territory. When need becomes dependence. Don't get me wrong. Normal, healthy friends listen intently about each other's depression or sadness. Sometimes you might even hear that someone wants to hurt themselves because they feel that down and need support. You're there for them. It's a significant testament to your friendship. And it's wonderful to trust that the same will be given, that this friend will have your back. Deep friendship during really hard times is a wonderful gift. What's much harder to tolerate or to cope with is chronic, intense dependence. What would I do without you? You're saving me from myself. This dynamic can sneak up on you in any relationship. What started out as a fairly even give and take somehow mutated into all give and very little give back. You slowly begin to realize how draining the relationship has become as you mute your own desires or needs. Ultimately, you can find that you're tired of conversations that are one-way, practically free therapy sessions. It can easily feel like the life is slowly being squeezed out of you. You feel trapped, and perhaps even emotionally blackmailed. You could easily be growing fatigued and resentful. But how are you supposed to get out, or at least change things? What's clear is that their emotional fragility needs to be professionally treated. There could be significant depression or a bipolar disorder present, where at times suicide can seem like the only way out. Or they could be struggling with a personality disorder, which is a consistently unhealthy way someone perceives themselves and others, as well as having little insight into the impact of their behavior. You need things to change, or you may even want out. And yet, you still care. What can you do about it? 5 proactive steps. Number 1. If your friend is in therapy, ask to join a session. Whatever your goals are within the relationship, be honest and take advantage of having the support of a therapist. You can discuss your need for a fundamental change so you're not burdened with being the only one they look to for guidance, or even a reason to stay alive. If closure in the relationship is what you're seeking, the therapist may be critical for your friend to help them through the change. Remember, it is the therapist's job to deal with the patient's danger to self, not yours. Number 2, if they're not in therapy, then ask them to go to a therapist with you. You may need a third party who can offer objective observations and give both of you support to navigate this terrain. If they refuse, you can meet with a therapist yourself. Hopefully, they can give you ideas about how to either get closure or to slowly create the boundaries that both of you need to abide by. Again, your responsibility is to look after your own emotional health. If they use you up, so to speak, not only will you be empty, but their source of support is waning or gone. Number 3, read some material on how to handle feelings of abandonment or emotional manipulation. I hate you, don't leave me. Stop walking on eggshells. Disarming the narcissist. Understanding the borderline mother. All these books are wonderful resources and might help you make adjustments in how you communicate. You might not have to leave the relationship if you learn how to step out of the responsibility they're attempting to give you and create more solid emotional boundaries. Number 4, tell others. You may have to tell your friend that you can't keep their secret and may have to choose to tell their family or someone who can legally be involved in their life. Some secrets are too heavy for you to carry alone. And number 5, look at your own need to be needed or in control. It may be that you have your own emotional reasons for creating this kind of relationship. Be honest with yourself and consider if you have the need to be needed, or maybe being seen as having it together. Those needs may be fueling your end of the problem, and you may have needed them to need you. Maybe you're lonely. Maybe you live in a fairly reclusive life. Maybe you're repeating a pattern that you're always there for others, but that pattern is now destructive in your life. In the end, you can't fix someone who has mental health issues that require professional intervention, and you can't be the only reason someone who struggles with the darker aspects of depression chooses to live another day, because that means you have to be there tomorrow, and the next day, and the next day, without fail. It's their very difficult battle to fight. You can support, listen, love, but not fix. You just listened to the post titled, 5 Things to Do When Someone Needs You Too Much by Dr. Margaret Rutherford of drmargaretrutherford.com. And be sure to stick around for my comments right after this.
This episode is brought to you by Shopify. Whether you're selling a little or a lot, Shopify helps you do your thing, however you cha-ching. From the launch your online shop stage, all the way to the we just hit 1 million orders stage. No matter what stage you're in, Shopify's there to help you grow. Sign up for a $1 per month trial period at shopify.com/special offer, all lowercase. That's shopify.com/special offer.
Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
Families have a lot going on. Let Ollie help manage the mental load with new cognitive help supplements for everyone 4 and up, like delicious Lolly Focus Pops or Lolly Mellow Pops for kids. And for parents, try 3 new Brainy Chews to help you focus, chill out, or get energized. Find these cognitive health buddies for the whole fam at ollie.com. That's OLLY.com. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
All right, and thanks so much to Dr. Margaret for this very serious yet very informative post. She's offered some really valuable tips here today, and rather than expanding upon them like I normally would, I'll instead use this time to refer you to the best places to find therapists should you or someone you know be in need of one. So I definitely recommend checking out Psychology Today, Zen Care, and the APA, or American Psychological Association's websites, most of all. The interfaces are all a bit different, obviously, But between the three of them, it's extraordinarily easy to find therapists and their fees, their specialties, biographies, locations, insurances that they take, educations, even videos of them explaining their approach sometimes. Now, additionally, should you be more interested in virtual therapy, in which you have a lot of flexibility when it comes to scheduling, there isn't as much waiting involved, and you do get a chance to text with your therapist as well as having video and/or phone sessions, BetterHelp is a great one. They've actually sponsored a lot of our shows in the past, and Talkspace is another one that's held in equally high esteem, and there are many others for you to check out as well. So get the help you need, everyone. Hopefully this post helped encourage you or your loved ones to do so. It's time to get going for now, though. So enjoy the rest of your Sunday, folks. Thanks again for stopping in. And be sure to start a new week with us tomorrow, where I will have more content for you. And that's where your optimal life awaits.